Good evening, everyone. My name is Joe Durant. I'm one of the senior instructors for the Center for Pain and Stress Research, and tonight we're going to be doing a tutorial on the Dolphin Neurostim. So if you have one, you might want to pull it out. And I do have to apologize. The cleaning crew is here in the building. They were supposed to be gone by now, so if you guys hear anything in the background, that is what's going on. They seem to like to vacuum on hardwood floors for whatever reason. Anyway, so tonight we're going to be going over the features of the Dolphin Neurostim, how to change the batteries, how to turn it on and off, how to find points with it, how to treat scars, and how to hook up the vagus nerve stimulation kit. So we have a fair amount of ground to cover. If you would, everybody look on the left-hand side of your screen and hit the mute button because this is being recorded, so you guys will get to watch this tomorrow. So we don't hear people's cats and dogs in the background. Thank you. And so we're going to do about an hour of instruction tonight. Then we're going to have about 30 minutes of question and answer at the end. If you have questions, you can certainly type them in the chat box and I will get to them at the end, or you can ask them in person at the end. So without further ado, grab a Dolphin Neurostim and let's start work. So starting at the tip of the Dolphin Neurostim, there is a biocompatible alloy tip. You will notice that if you push on it, it does not poke a hole in you because it is spring-loaded. Because it is spring-loaded, there is a conductive medium that's around the spring down in here. And when you go to clean this device, we do recommend that you use like alcohol wipes, just a little single-use alcohol wipes. Don't pour liquid down in here because that can cause corrosion around the spring and it interferes with electrical conductivity. So moving up from there, there's a little black button right here. This black button, you'll notice that when I push it down, does absolutely nothing because the device is off. However, when you are doing a treatment, you will need to hold this down. As long as you're holding this button down, you're doing a treatment. And when you release that button, the treatment has stopped until you push the button again. Moving up from there is a roller switch. So this roller switch serves three basic functions. It turns your unit on and off. It also serves as your battery test. And it also allows you to modulate how intense the treatment is. So when I turn this on, you can hear there's a steady beep. If I flip this over, you should see a green light right here, which you don't see. It should look something like, let's see, let me grab another one. Not sure where I put them, but anyway, you should have a green light right here. If you don't have it, that is an indicator that your battery is dead or about to die, not completely dead. So what you need to do is turn the device off and change the battery. So we're going to go over that at this point. If you look on either end of the Dolphin Neurostim, you will see there are two little screw holes. We run into problems with people trying to take those screws out to change the battery. If you take those screws out and try and take this apart, parts are going to fly everywhere. You're going to void your warranty. You're going to have to send it back to us to have it put together. And there's a perfectly good battery compartment door right here, and we're going to use that instead. It sounds a little silly, but it happens quite a bit. So you need either a quarter or something like a screwdriver or a pocket knife. And you're going to pop this open. This will come right out. You'll see there's a standard 9-volt battery in there. If you give it a little tap, you can pull it right out. We do recommend 3 different types of batteries for this device. We recommend Duracell 9-volt batteries, Panasonic 9-volt batteries, and Energizer 9-volt batteries. If you choose to use anything other than that, you are kind of taking your fate into your own hands, because the problem we run into is that not all 9-volt batteries, these are all the same size, but not all 9-volt batteries are the same size. So it's just a thing in manufacturing. All C batteries, D batteries, A batteries of any kind, those are all the same size. But 9-volt batteries vary a little bit. Some are a little bit longer, some are a little bit shorter. And if you put a battery in here that's too short, you'll notice there's no cable to attach this to. So it's a fixed battery compartment. So if you put a battery in here that's too short, it's going to rattle around and you're going to get intermittent contacts and it's going to interfere with your ability to conduct a treatment. On the other hand, if you get a battery that's too long, it's not going to fit. And if you force it, you're actually going to break some of the components inside the device. So like I said, stick with these batteries and you'll be okay. If you try to use cheap dime store batteries that are the right size, they will dump a lot of their voltage at the same time and kind of all at once, and you can actually burn up the circuit board in here. So I would shy away from those as well. All right, so you're going to look at the little chart that's in here, grab your battery of choice and put it down in here. It's a tight fit, so it's going to fit snug in there. And when you go to put this battery compartment cover on, it's going to snap, like it's going to break, but it's not going to break. And then you turn the device on and you should see a green light on the other side of it, just like this. So once you see that green light, you are good to go for your treatments. All right, so if I turn this on, I can check for a green light. That lets me know that my battery is good. The more I roll this, the more intense the treatment is. So when you're in the middle of a treatment, you can actually adjust this on the fly with your fingers, and it keeps you from having to stop in the middle of a treatment and go back and readjust it. Moving up from there, you'll see there's a little tiny black button right here. It does nothing when the device is off, but when the device is on, so you can see I got a green light and you can hear a tone. So I'm going to push this button, and now you don't hear anything at all. But this device is actually in a constant treatment mode that's timed. So it'll do this for about 11 to 13 minutes. And at the end of the treatment cycle, it will revert back to this constant tone. So you're going to use that mostly when you do when you do vagus nerve stimulation, but occasionally you also may use it during scar therapy. So this is a great little feature. We had problems in the past with people falling asleep doing vagus nerve stimulation and doing hours and hours of vagus nerve stimulation. So we decided to put a timer on there. And it's useful because if you work in a therapy setting, most of your treatment codes are about 15 minutes long. So it's going to cue you kind of at the end of the treatment so you can move on to whatever else you have. Because these days, in the States at least, you get 4 CPT codes you can use on a patient for each treatment session. And once you go beyond that, you can charge the patient, but their insurance isn't going to pay. All right. Moving to the back of the unit, you will see that, let's see if I can get this to focus for you. There are 2 slider switches on here. One says wet, normal, and dry at the bottom. So you can slide this back and forth. This is going to affect the sensitivity of the ohm meter on the device. So this finds trigger, motor, and acupuncture points. It does that by testing your skin for conductivity. And the points that are more conductive are going to be your treatment points. So the problem with that is that, like down here, I live in Georgia. It's the South. It gets hot. It gets muggy. A lot of patients come in who are sweaty, and sweat is salt water, so that makes your skin very conductive. So for a patient like that, I would need to slide this over to the wet setting so that the ohm meter is a little less sensitive. Now, if I were somewhere like Michigan right now where it's really cold and the air is dry, then I would take the device and slide it over to the dry setting. For the most part, if you keep it on the normal setting, you're good. So just to kind of wrap all that up, if you put this on the dry setting, that's the most sensitive setting. If you put it on the wet, that is the least sensitive because your skin becomes very conductive once it gets wet. Moving up from there is another little slider switch that says polarity. So the polarity, this correlates to 2 things. Part of it has to do with acupuncture. So part of it has to do with bringing things up and bringing things down. In acupuncture, that's known as tonifying or sedating. So if you're going to bring things down, that's sedating. And that's going to be most of the conditions you're going to be treating, or it could be conditions of excess. So that's things like headaches and nosebleeds and heart attacks and shingles and tight muscles and nerve impingements and
Can you put this on my charger?
fill in the blank. And that will, that's most of what you're going to be treating. So if you left this on the negative setting most of the time, you would be fine. But you do have some other possible settings on here. You've got the positive setting right here in the middle. So you can flip it over to the positive setting. So that's to tonify things and bring things up. So if you had somebody who's got, for example, like Bell's palsy and their face were drooping, you might want to treat points on their face to bring tone into the area. It's also useful for things like acupuncture facelifts. And there are some conditions that are, instead of being excessive, are deficient. So if your adrenals are completely shot, you may need to tonify the kidney meridian to bring your life essence up. So it roughly correlates to sedation and tonification in acupuncture. But if you've never dealt with those, think of it in terms of, do you want to bring this condition up or do you want to bring it down? And for the most part, that's pretty easy, but it gets a little tricky when you start talking about things like constipation. You think you would use negative or positive on that? Well, you want to use negative because it's a condition of excess. It's too much. But on the other hand, if you have diarrhea, that's a condition of excess as well. So both of those are conditions where you would probably want to use a negative polarity. So it's not always exactly a straight line. Down from there is a little metal plate, or I should say up from there is a little metal plate. This metal plate is extremely important once you're doing treatments. When you are doing a treatment, you need to touch this metal plate, and we recommend that you touch it with your thumb, and you hold the device like this so it's resting on the little V between your index finger and your thumb. And this allows you to place the heel of your hand down and use fine motor control. Because when you start to try to find acupuncture points and trigger points and motor points, some of them are very small and you have to move very carefully. If you move too quickly, you'll brush right over the point and you won't even register that you're on it. So I do recommend that you hold it this way. I have seen people hold it this way and try to push this button with their thumb. That is a bit inconvenient. So if you have some kind of condition with your fingers, you could certainly do that, but much better to keep your thumb on there. That allows you a whole lot more ability to adjust things on the fly. So that is all the little features of the Dolphin Neurostim. So now we need to move on to how to find points with this device. So when you're using this device, it will find Chinese acupuncture points, it will find myofascial trigger points, and it will find motor points. How does it do that? It measures how conductive your skin is. So if you were to take an electrician's ohm meter and run it around your skin and watch the dial, you would see varying levels of conductivity. And at some point during the 1950s, somebody discovered that there are areas on the body that are more conductive than others. And somebody else noticed that they seem to be in the same location as acupuncture points. And when they went and correlated them, they found out that yes, indeed, acupuncture points are highly conductive to electricity. So the higher the conductivity, the greater the chance it is an acupuncture point. And so all acupuncture points are always going to be more conductive than the surrounding tissue. And when you have pathology, they're going to become even more conductive. So the worse your pathology is, the more conductive the points become. And this device will allow you to find those points because it has a point finder built into it. So to demonstrate that, I'm going to bring out our handy dandy, let's see, I'll grab the Vagus Nerve book here, the Vagus Nerve Recovery Manual. And I'll just pick out a page in here that has some acupuncture points on it. Let's see here. Oh, that's a good one. I'm going to look on, in this one, unless this is a revision you don't have, this is on page 12, but it just says general recovery points. You can see there's a little graph here. You don't really have to be on the page, but we're going to look for this point right here in the elbow called large intestine 11. And we're also going to look for this point right here called large intestine 4. So to find those points, you are, pardon me just a minute. To find those points, we're going to mark them first, and then we're going to use our point finder. So I'm going to pull this down a little bit. We're going to look for large intestine 11. So large intestine 11 is going to be at the end of the elbow crease right here. And you go to the end of the elbow crease. I'm going to put a little red dot right here about where the point should be. Large intestine 11 is a great homeostatic acupuncture point. It's good for all kinds of things like fevers. I used to use it on my kids a lot when they were little. When I turn the Dolphin Neurostim on, I should get a nice green light like this. I want my thumb on the metal plate. If I'm treating someone else, I need to touch their skin. And I'm going to pull this around over the skin. Now, I'm going to flip this around so you can watch. So you can watch what happens when I get over that red area where I've marked on my arm. And you can see there that the light has gone out, which indicates I'm on top of the acupuncture point. So there are two things that should happen when you find an acupuncture point. You should have a really high pitch with the device, and you should also see the green light go out. Now, there are a lot of questions you guys are going to have later on about this light when it starts to flash and blink, and what does that mean? So the best advice I can give you on that is to look at this light when you turn the device on to make sure the battery is good. And look at the light when you're looking. Somebody has their doesn't have their phone or computer muted. Let's see here. I think MJ and Darius don't have theirs muted. If you guys can mute your microphones, please. We're hearing what's happening in the background. Thank you. Okay. So back to what we were talking about. If you start trying to look at this light at any other point, sometimes it may flash and sometimes it may not flash when you're doing treatments. Don't pay attention to that. Just look at the light when you turn the device on to make sure the battery's good, and look at the light when you're finding points to make sure you found the point. Other than that, it'll just confuse you. All right, so back to large intestine 11. Great homeostatic acupuncture point, great for fevers, great for any kind of condition that requires homeostasis. And I can go back to this point over and over again. I can pull this across the skin. And when I get on top of the point, you will see that the light goes out. And I can go back to that point every single time and get exactly the same outcome. So it's a fairly simple point finder to use, but there are a couple of things you need to know to make sure you get the most out of it, because you can actually trigger what we call a false positive with this device. So most of your skin is not very conductive to electricity, but if I take this device and go to a non-acupuncture point and push down really hard, I can get the light to go out. I can do that anywhere on my arm, on my forehead, wherever. I can get the light to go out. Those aren't all acupuncture points, trigger points, and motor points. What I'm doing is I'm squeezing the skin down so much that it's bridging the gap and it's becoming more conductive to electricity. So if you push really hard with this device, you're going to get false positives. So you want to use just mild to moderate pressure and move slowly. I use little concentric circles when I'm looking for points. And if you move too quickly, you'll sweep right over them. You'll see the light flicker for a second and then it's gone. So move slowly with this and then you'll find your points. All motor points are acupuncture points, and about 80 to 85% of myofascial trigger points are also acupuncture points. So most of the points you're going to treat, you're going to find in one of our manuals. They're pretty good graphs for most of those points in there. Okay, let's see. Another acupuncture point from that page. Let's see. What do we have? Let's look for Hoku, which is large intestine 4 right here, known as the great eliminator in acupuncture. It is probably the most widely used point in acupuncture for pain. People say, hey, if you've got a headache, it's a great point. You can just squeeze on that and it makes it feel better. And it is a good point for tension headaches. We do not recommend treating this point for migraine headaches because it's a highly sympathetic point and it will make a migraine go away in most cases. But in about 50% of the cases, you'll get a rebound headache that's worse than the initial headache because it's such a male sympathetic point. So there are other points that work a little bit better for that. To find the point, the biggest mistake people make is they look in the flappy part of the skin right here, and you really need to be kind of up in the meat right here. So if I take my hand and I squeeze my thumb against my index finger, it makes a little mountain like this. And at the top of that mountain is going to be about where my acupuncture point is, like this. So that if I open my hand up, I'm a little bit off of my point location there. So I'm going to move this a little more to the inside. We're going to take our device, turn it on. Again, always check to make sure you got a green light, which, let me stop for a second. Battery life, I use these devices. Gosh, I did 10 hours of therapy today, and I used these for about 20 minutes during each therapy session. So, that's 200 minutes of therapy right there. They're fine. I change the batteries in these about once a month. So you get quite a bit of time out of a 9-volt battery. All right, turn the device on, check the battery. Pull it across your skin. And you get over the point, you will find Hoku right there. If you move up a little bit right here, you'll find what's called surgical Hoku, which is an acupuncture point that's used for like dental extractions and stuff like that. But anyway, this point is known as a great eliminator. It's great for kind of making things go away. So body-wide pain it's good for. It's a distal acupuncture point that treats a proximal area of the body. So it treats the anterior neck and the face. So it's good for jaw problems, nose problems, mouth, any kind of problems on the front of your face it's good for. And tension headaches it works pretty well for too. We do not recommend treating this point on people who are pregnant since it is known as a great eliminator. It's one that forces energy down and out. So you would want to avoid that because you don't want to push a baby out until it's time. Okay. So that's the basics of how to find acupuncture points with this device. They're in each of the books that comes with this device. I'm going to pull out this natural health book and I'm going to look up, let's see, we're going to pull out a protocol for gout. And if you look by each of the points, there's either a minus or a plus. So each of the numbered points is going to give you the exact polarity that you need to use. So if you just look at the book and correlate the polarity with what you see in the book, you're good. For those of you who have not had any exposure to acupuncture, so a real quick primer here so you're not completely lost. In the world of acupuncture, there are a series of energy lines known as meridians. You can see them on this model. They run up and down. The female ones, which are called the yin points, are on the soft parts of the body. So that's the front of the body, inside of the arms, inside the legs. The male points are on the hard parts of the body. Those are the yang points. Those are on the outsides and the back. So these are all yang points. And these, for the most part, are all yin female points. Yang points are points that you use when you're trying to get things done, like release frozen shoulders, release psoas muscles. Yin points are things you use when you're trying to either calm things down, nurture, or heal. That's when you're going to use those points. So if you got somebody who's really ramped up and anxious, you're going to use a lot of female points. If you're trying to release specific muscle groups, it tends to be more male points that releases those better. Each of those points is named after an organ system in the body. You got lung, pericardium, heart, liver, spleen, kidneys, liver. There's all these different meridians in acupuncture. Half are male, half are female. The female ones are the ones that are vital for life. That's like your heart, your liver, your lungs, the things that if you take them out right now, you're probably dead. The male points are, according to one acupuncture book that I read, it said the male points are, the yang points are like a man. They are hollow, superficial. They tend to fill up and empty, and you can live without them. So there you go. That's what the book says. So each of those points on each of these meridians is numbered. So you'll have spleen 1, spleen 2, spleen 3, heart 4, heart 5. So when you look in the books, each of these points is going to be a numbered acupuncture point, and you can correlate that with any acupuncture doll or online. There are lots of free online resources you can get for looking up acupuncture points. Okay, that is how to basically find acupuncture points with this device. So now we need to move on to how to treat a scar. That is one of my favorite things to do with this device. I have been using this system for, let's see, probably almost 25 years now. I've worked in neurology, neurosurgery, physiatry, and women's health settings with this. I have treated tons and tons and tons of scars, C-sections, hysterectomies, mastectomies, joint replacements, all kinds of spine surgeries. And you will not find anything else on the market that can release a scar as quickly as this can. We have tested it against injection therapy, scraping therapy, laser, like you name it, we've tested it. And they're all pretty good. This just happens to do it better than most because scars are an electrochemical problem. So when you have scarring, scars are not very conductive to electricity. But if you can change the polarity of the scar, if you can repolarize it, so most body tissue has a negative charge, scars tend to have a positive charge. If you can flip the charge from positive to negative, it tends to become conductive again. When it becomes conductive again, what ends up happening is you get lower density in the scar tissue itself. So you can't ever really get rid of a scar unless you cut it out. But you can change the density of the scar. And what we happen to know is from doing some diagnostic ultrasound studies, you will get about a 20% reduction in the overall density of the scar with one treatment of this. It's really fast, really fast. So you figure like 5 or so treatments for the average scar, and you're kind of done with releasing the scar. And I can tell you after literally decades of using this, it's rare for me to go over 5 treatments with a scar release of this unless I have a really involved patient. So somebody who's got like really big steam burns from an industrial accident, those take a long time because it's a lot of surface area. Anytime somebody has had like major skin grafts in areas, that takes a little bit of time. And I've had some pretty messed up mastectomy cases I've seen over the years. And even those you can usually get done in 5 or 6 treatments. So it's a really effective treatment. And I really like how well this works. It's so fast. The patients love it. My expectation is when I see a patient on the first treatment, I should be able to get them somewhere in the neighborhood of a 50% reduction in their overall pain from the scar. And visibly, the scar should change as well. So you'll see scars that are puffed up, they'll flatten out. Scars that are dipped in, you'll see those rise up and level out. Scars that are hypertrophic, that are kind of purple and red and angry looking, sometimes they'll start kind of flashing colors when you're treating them. And they will generally turn a nice pink color rather than really ugly inflamed looking colors. So it is a really fast treatment. So let's talk for a minute about the reasons why you might want to treat a scar. The first reason you probably want to treat a scar is because it's painful. But there are other reasons too why you might want to treat a scar. There are people who are interested in treating scars for cosmetic reasons, and you can certainly do cosmetic treatments with these. Now, if I'm looking to change how the overall scar is going to look, like really, really blended in, it's going to take more than 5 treatments. But functionally, 5 treatments is really good for overall kind of plasticity of the scar. But if you're going to be doing cosmetics, you may need to take a little more time. So cosmetics, pain, range of motion is a big issue. That's a big reason why people want scars treated. You'll see a lot of times people will have joint replacements and they'll go and have like a knee replacement done. And then when they go to check their range of motion, they're always, even with good physical therapy, they're always lacking a few degrees at the end. A lot of times the doctor will tell the patient, look, this is just scar tissue. We can't really control how your body scars. But if you could get this broken up, it would probably be better. And usually if you do a couple of treatments for the Dolphin Neurostim, you can free up the rest of that range of motion, which brings up another point. How soon after surgery can you do this therapy? So obviously you don't want to stick this in an open wound. That would be kind of silly. But what we do know about using microcurrent is it does increase ATP production by 400 or 500% on the order of what a really good laser would do. So ATP is adenosine triphosphate, which is a mitochondrial fuel. So it really ramps up the healing process. This will also increase protein synthesis and cellular membrane transport. So as soon as you have surgery, you can immediately start treating afterwards. Even if you can't get directly by the incision, because a lot of patients have dressing, you can get close enough. You can bounce current back and forth through there, and that will dramatically speed up the healing process. In some cases, if you know where the incision is going to be, you can actually pre-treat it before surgery, so you can kind of load the tissue with ATP so it starts healing much faster as soon as they get into recovery. So immediately after surgery is fine with these. Just don't stick this in an open wound. The thing to remember is that scars do go through a period of a year or more of tissue sort of modeling, and the tissue actually changes over the course of a year or so. So a very old scar is easier to treat than a very new scar, because a very old scar is kind of set in its ways. It's not really going to change. It's not going to go through any more tissue remodeling, but a brand new incision is going to go through a year or so of change. So you may have to go back and retreat it over time. So why else might you want to treat a scar? Like we talked about, range of motion could be an issue. It can even be an issue from a distance. So I've seen cases where people have had things like hip replacement scars and had shoulder restrictions. So they presented as almost having a frozen shoulder, and they've had injections in their shoulder and massage to their shoulder and all kind of stuff, and it didn't get any better. But then when you go and you treat the surgical incision that's along that line of fascia, the connective tissue of the body, then you get your range of motion back. So I've seen that in a number of cases. Fascia is connective tissue that covers your entire body. It's like a body stocking. Anytime you put cuts through it and stick it down, it pulls throughout that entire network. Sometimes it's a very dramatic change in range of motion, and sometimes you don't notice it until years later. But I would recommend that if you have these devices and you can treat scars, I would treat all the scars that you have. You just don't know how much one little scar may end up affecting things. So other reasons to treat a scar: scars can affect lymphatic flow. So you get somebody who's had like a mommy makeover, like they've been cut all the way around here. Well, they have all this lymph down in their legs that has to get up to here to get back in the body. And the problem with lymph is that it doesn't move through veins or arteries. It kind of moves through potential space between muscles and fascia, kind of works its way up through there. And if you go putting blocks across that, you tend to get a lot of swelling down in your lower extremities. So treating scars is also good for lymphatics. Treating scars also releases blocked energy. So anywhere you have a scar, ones that people miss a lot are carpal tunnel surgery scars. There's some really important meridians that run through there. Anytime you have a scar, that can block the flow of energy from an acupuncture perspective, and it can do all kinds of stuff. It can act as a almost like an accelerant for the sympathetic nervous system. Something that I've seen in a number of cases is people will have a surgery of some kind, and then about between 6 and 8 months later, they start having anxiety attacks. Never had a reason to have anxiety attacks before, never had any trauma, never anything, and they start having anxiety attacks. So scars can harbor a higher resting charge in the surrounding tissue. Your body normally holds a resting charge of about 80 millivolts. Scars can hold a resting charge of somewhere around 1.6 volts. So it's a considerably larger piece of electricity in that area. And it can hold that, and it'll stimulate the local sympathetic nerve fibers, because the sympathetic nervous system covers like 90% of your body. And it has to do with things like microcirculation and sweating and how wound up your fight or flight response is. So if you have a scar, over time, it stimulates the sympathetic nerve fibers 24 hours a day, 7 days a week. Not a lot, but a little bit and all the time. And it will wind people up. And I have seen cases of patients who had weird emotional stuff, especially anxiety attacks. And you can go and treat the scar from their surgery, and you'll find that very quickly the anxiety will resolve itself. So that's something to pay attention to. So that's most of the reasons you're going to treat scars. So now let's go into how to treat scars. To treat scars, you cannot just use one Dolphin Neurostim. You really need two. It makes it work much better. So if you happen to have another one handy, you can pull it out. So why is it that you want two of these instead of one? Well, the problem you run into is this. Because scars don't conduct electricity well, if you were to take like a standard TENS unit and you had some pads like this, if you tried to put one of these pads over a scar, so let's say you had let's draw a little scar up here. Let's say you had a scar here and you stuck a TENS pad over it. What's going to happen is the electricity is going to go all around the scar, but it's not going to go through the scar. Electricity always takes a path of least resistance. So if you try to use a large pad to pass electricity through the scar, it's just not going to work, because it's going to take the easiest route. So if you want to release a scar properly, what you need to be able to do is repolarize the tissue. It's an electrochemical problem. So the probably next most effective therapy to this for releasing scars is something called neural therapy injection, where they use procaine. Procaine is a local anesthetic, and what they'll do is they will inject it. Let's say you have a scar that runs from here to here. They'll stick the needle all the way up through the scar and start injecting. They'll actually bubble the scar up with procaine, because procaine will repolarize the tissue. So it's not the anesthetic effect you're looking for. It's actually the electrical properties of the procaine itself. Once it repolarizes the tissue, then it relaxes. Well, this does the same thing, but you don't have to stick a needle in a patient to do it. So how does this do it? Well, you need to be able to push from one side and pull to the other. So you need two separate sources of electricity, and they need to be direct current. Alternating current is just going to bounce back and forth the whole time, and you're not going to get a great connection there. But if you can use direct current, it allows you to change the flow of electrons, whether they're coming out of the tip of this unit or out of this little plate. It allows you to push from one side and pull to the other. It allows you to basically play a game of ping pong with electrons. So to demonstrate what we're talking about, let's say that we have somebody who had open heart surgery. So let's make a very unhappy dude here. See, he's pretty unhappy because he's had open heart surgery, and his surgery went fine, but the problem he's having now is that he has really, really bad pain back here. Not along the surgical site, but he has horrible pain in his upper back. And that's actually quite common after heart surgeries. So he's got this angry scar. They've cut him open, and then they've taken a Black & Decker power saw and sawn his sternum open. So he's got this nice long zipper scar right here. So we need to be able to bounce electrons back and forth through this tissue. So to do that, you're going to take one of your dolphin neurostims and you're going to put it on the negative setting. This slider switch right here on the bottom for skin type does not matter because you're not looking for acupuncture points. For the most part, the light is probably not going to go out when you do this. On the other device, you want to slide it over to the biphasic setting. So that's plus minus. So we didn't talk about that yet. But there's a minus setting, a plus setting, and a plus minus setting. So the plus minus setting allows you to bounce the current some. It allows you to make the current alternate without the current being alternating current. You have to remember that alternating current is extracted from direct current. So direct current has the property of being able to alternate without being alternating current. So how do we do this? We take one dolphin neurostim, we use a negative polarity on one side. On the other side, we use a biphasic setting like this. And we are going to go along the sides of our scar. We're going to go on either side of the scar like this. And we're going to count. So I'm about 1/4 of an inch off the side of the scar. And we're going to count out 10 beeps. So you're going to push the button down. Now, when you go to find these points, you're just going to set the device down. You're not going to look for a light to go off. You're not going to listen to the tone because chances are the light's probably not going to go out and you're not going to get a high pitch. And you're going to count out 10 beeps. After that, you're going to move 1/4 of an inch down the scar and repeat 10 beeps there. So we're going to do that all the way down the scar. When you get to the bottom of the scar, it makes a certain amount of sense to me to change the polarities around a little bit. So you can either slide the switches. I usually just change the devices from one hand to the other. And I start at the bottom and I start working my way back up. And I try to get between the points I've already treated. So that's 10 beeps all the way back up again. Then I'll change them one more time and do the same thing all the way back down. So 3 times at 10 beeps. So you're going to go down, or up, down, up. I don't care what you do. I just want to make sure that you guys are bouncing electrons back and forth through this tissue as much as possible. This is all about the electrons. This has nothing to do with acupuncture. This is all an electrochemical thing. The more you do this, the greater the chances are you're going to repolarize that tissue, and the greater the chances are you're going to be able to release it. Now, could I do longer than 10 beeps? Absolutely. When I treat people, scar therapy is one of the things that I market. I market surgeons for that. So if you're interested in marketing that, I will give you a couple of helpful pieces of advice. People who've had things like open heart surgery don't tend to have a lot of extra cash lying around. But people who've had plastic surgery do. So you can certainly treat the people who have significant surgeries that were not elective surgeries and help them out quite a bit. But you got to remember that somebody who's paid $10,000 or $15,000 for a facelift or a boob job or whatever it is they've had done, if they have painful scars afterwards, they may not look painful. They may be nice little thin silver, but they can still be quite painful. They have cash to pay you for the service. And remember, they did that to themselves. Like they asked for that. So it's a good source of revenue, and it gives you the option of being able to work in, because I do a lot of treatments with veterans. Like I got guys who've had their legs blown off and things like that. I'm not going to go charge those guys any money for that. I mean, they've already, they've already paid for their, they've paid us. So it's time to pay them back. So, you got to treat a few in there to kind of offset that. So you can certainly market this to surgeons if that's what you want to do, because it doesn't really, to a surgeon, once he's done his job, the scar tissue isn't really an issue for him. Like he's surgically done what he needs to do. The scar tissue is an effect of your body. So it's not a reflection on them if somebody has scarring afterwards. It's just how your body heals. So it's not really a conflict of interest for them. And it doesn't interfere with the surgeries they do. They still make their money. They're just happy to have somebody they can refer the patients to get this taken care of, so that their patients have a good continuum of care. So what are other scars that would be significant? Any abdominal scars, C-sections, hysterectomies, anything like that, super significant. They tend to pull people forward, and then you end up with people with forward head posture, and they end up with posterior neck pain and back pain because they've had surgery across here. So let's say you've had a C-section. Like I said, I used to work for a bunch of OBGYNs, so I've seen this quite a bit. Somebody goes and cuts you open, yanks a baby out, stitches you up, and hands you a kit. At that particular moment, you realize exactly how hard it is to pick up 8 to 10 pounds with your tummy having just been cut open. How much you use your abdominal muscles is significant when you're lifting things. So what people tend to do is they tend to bend forward because they still have to take care of their kid. So they tend to bend forward to get away from the pain, and they heal like this. And then you've got somebody who's set up to have neck and back problems after that. And you have to remember that if you have one abdominal surgery, and it doesn't matter if they cut you all the way across, or they could just put tiny little holes in you like this so they can do this stuff with a scope. Either one of those, you have an 80 to 85% chance of getting abdominal adhesions, which is scar tissue that goes beyond the boundaries of the scar itself. 2 abdominal surgeries, it's a 100% chance. So why is the abdomen like so sensitive? Well, historically, anything that threatens to make your entrails into your extrails is pretty significant. So your body sort of flips out and starts laying down scar tissue. Now, if you already have a really inflamed system, like you have a history of autoimmune disorders, or you have, like fill in the blank with what are an inflammatory response, it increases the chances you're going to get that. So anyway, you can do some treatments for that. But let's say you can't see that scar. Like, what do we want to do in that case? And let's say it's really deep scar tissue. Well, it's really difficult to get in and do gua sha deep down around somebody's kidneys or around their intestines, but you can use electrons to do that. So there are some ways you can go about doing that. And I'm going to jump ahead for just a second and touch on that. So in the vagus nerve stimulation kit, one of the things you have is a white wire like this that has either two male connectors or a male connector and a shrouded male connector. It looks like a female connector, but it's not. So there are some electrodes that look like this, that are little oval electrodes. So if you take one of those and you stick it on one of your Dolphin Neurostims, and then get yourself some of these nice little pads like this that come with the kit. What you can do is you can draw electrons completely through the body. So let's say I've got somebody with deep abdominal adhesions in here. I can take this pad and I could stick it on their back. And now, so see, I've got pad on the back running to a Dolphin Neurostim here. Okay. So now when I treat this person, what's going to happen is that those electrons, in addition to getting bounced back and forth between these two devices, are going to get pulled deep down through that scar tissue. So if you want a really deep scar tissue release, use this cord and it'll help you out quite a bit. We'll go over that a little more in a bit, but I wanted to throw that in while we're talking about scars. What if you had a scar that's not a linear scar? What if you had a scar that instead of being a really long line, suppose it looks like this, like a steam burn scar? Like, what do you do for something like that? Same thing you do for any other scar. You're going to take your Dolphin Neurostims. You're going to go on either side of the scar and work around it like a clock. So you just work all around the scar. And I usually do 3 circles around the scar. So same thing like we did up and down the scar, 3 circles around the scar. And this is the part that takes longer because you have a lot more surface area in here. You're going to actually go through the scar tissue itself like this with your devices just randomly to kind of pull electrons through it. So when you've got a linear scar like this, and you've gone up and down through the scar this way, then you can switch out and you can go on top of the scar this way. And what I'll typically do, like if you look what it says in the books, they'll typically say like plug the ends of the scar, stay at the ends of the scar. but I find it worthwhile to actually work my way through the scar like this and do 3 passes up and down on the scar tissue. Now, why wouldn't you treat on top of the scar tissue first? Well, you don't treat on top of the scar tissue first because its capacity for conducting electrons is a lot lower. So once you bounce current back and forth through here, you're opening the channels up. So now once you go on top of the scar, you've got a conduit to pull current through there. You can try it backwards. It just doesn't work as well. Is there a specific study that says you have to do one first and the other second? No, but I can tell you after 25 years of doing this, it works better if you treat on the borders of the scar, outside the borders of the scar first, and then on top of the scar. All right, where are we on time? We're at about 8:16 right now. So that's most of the stuff about scars. The next thing we need to talk about is vagus nerve stimulation. But before we get into vagus nerve stimulation, we need to talk about some contraindications for the Dolphin Neurostim in general, what you can and can't do with this device. I like to talk about what I call Joe's rule of pencils. Don't stick this thing anywhere you wouldn't stick a pencil. Don't jam it in your eye. Don't ram it up your nose. Don't stick it deep in your ear. Don't stick it in the back of your throat. Keep it out of places you wouldn't stick a pencil, and you're fine. Can you treat people with epilepsy? Yes, you can. Just don't treat right on top of their head. There's a point right there that is contraindicated, even in acupuncture with needles. But other than that, there are specific acupuncture points that are used to actually stop seizures, and I have seen it done. I've had someone in my class have a seizure, and we had to use this device to stop the seizure. It works very, very quickly. So if someone has epilepsy or history of seizures, don't use it on top of the head. If somebody is pregnant, don't treat on top of the head. Don't treat on the tops of the shoulders. Don't treat large intestine 4. All those are points that push energy down and out. You want to keep the energy in, not push it out. If somebody is pregnant, avoid any points around the inner ankles. There are a couple points there that are used to set off labor. We've actually done it when I was working in women's health. We've actually used those points to accelerate somebody's labor. Now, it's probably not going to set off labor if somebody isn't ready to go into labor, but I wouldn't mess with it. The other thing I will tell you about treating people who are pregnant is don't do it without the doctor's okay. Check with whoever the OBGYN is, and usually they're fine with it because they prescribe TENS units for pregnant women all the time. They slap pads on their back with an alternating current unit using thousands of times more electricity than this does, and it's fine. They just say don't treat over a gravid uterus, like stay away from treating over right here, and you should be okay. How about cancer? Can you treat cancer with this? Well, because it's classified in the microcurrent TENS arena, you should avoid treating over active cancerous tumors with this because this does increase ATP production, and it will potentially increase growth of things. Now, with that being said, you need to keep in mind that there actually is a system on the market for treating brain tumors that is a microcurrent system. It has an FDA approval for shrinking tumors in your head. So you can draw whatever conclusions. This doesn't have that indication, but I'll let you draw whatever conclusions you want from that. It's certainly a useful device for doing things like controlling nausea during chemotherapy. That works quite well. I used to have an oncologist on the floor above me, and we tested it several times on his patients, and it worked quite well. All right. Other things not to do with this. Treating children is fine. Just turn it down a little bit. Treating babies is fine. We've actually done workshops for hospitals, like All Children's Hospital down in Tampa, and they were using this device for spasmodic torticollis in babies with wry neck. There's a couple acupuncture points in the hands you can treat. They work pretty well. When my children were babies, I use this for colic and all kinds of different things. It works great. Fevers, fussiness, whatever. It's a good device. Mm-hmm. Other things you can and can't do. Plates, screws, rods, pins, artificial joints, all those are fine. Not a problem. They're not going to spark. They're not going to melt. They're not going to anything. They're fine. Sometimes one might tingle a little bit, but it's fine. Pacemakers, defibrillators, those, if you're going to do something like that, you need to check with a cardiologist first and have them say yes or no. That is completely up to them. Otherwise, I would stay away from it because electrotherapy can be contraindicated in those situations. So other things you guys might need to know. Dorsal column spine stimulators, baclofen pumps, insulin pumps, bladder stimulators, all those are fine with this device. I just typically have the patient turn them off. Usually they have a remote control for like spinal stimulators. I just have them turn that off so the two different types of current aren't competing with each other for what's going on. But other than that, they work quite well. I think that's about it. That should cover everything. If you guys think of any other questions you would want to ask about contraindications, just throw it in the chat box and we'll address it in a little bit. All right. So last on our list of things to go over is how to do vagus neurostimulation. What is the vagus nerve and why would you want to stimulate it? Well, the vagus nerve is the longest nerve in the body. It's called the wandering nerve. It starts kind of in your brain, but on either side of your head, comes down together in your chest and goes down to your gut. It is the information superhighway between the brain and the gut. More information goes from your gut to your brain than goes from your brain to your gut. It has a very, very strong influence on the sympathetic and parasympathetic nervous systems. So when you look at this little dolphin device, you'll see this yin and yang symbol here. The white side is the yang side, which is the sympathetic nervous system. The blue side is going to be the yin side, which is the female and healing side of things. You can use this device as a neuromodulator to affect things that have to do with the sympathetic and parasympathetic nervous systems. So this device is different than how regular acupuncture needles work. So there's variances between the different types of therapies and stimulating acupuncture points. What happens electrically? So this will do a really good job of bringing down sympathetic nervous system activity when it's overactive. And it also does a very good job of bringing up the parasympathetic activity, which is your ability to heal from things. So how do you quantify that? Well, there's some numbers we look at. So if you do an EKG on patients, you can pull something called HRV. So you might want to, if you're not familiar with that, you might want to Google it up. There are somewhere in the neighborhood of a bazillion studies on heart rate variability, HRV. Everything from sleep number beds to Apple Watches to high-end elite athlete gyms track heart rate variability. It is a very good predictor of your overall health and longevity. It can even be used to predict in racehorses whether or not they're going to get injured before they actually get injured. If those numbers are down, there's a pretty good chance they're going to get injured. And if they get injured, they may not be able to return to track training. So this number is studied a lot by the military. It's studied a lot in high-end athletic circles. It's an total power of your sympathetic and parasympathetic nervous system. The higher this number is, the better off you are. This raises your heart rate variability significantly. And over time, you can keep your heart rate variability up. The better your heart rate variability is, the less you're going to get sick, the less you're going to get hurt. And if you get sick, you're going to recover faster. And if you get injured, you're going to recover faster. This also has a very strong impact on high frequency vagal tone, and that is designated in research as HFF. You can look that one up too. There's probably 20 different variables you can look at, but these are two of the big ones. High frequency vagal tone is your ability of the parasympathetic nervous system to help you recover once an insult has happened to your system. So what are some things that would be good for? Well, let's say you have something like COVID. So this is a great device for modulating your healing response. So I'll tell you a little story about COVID. When I had COVID back during the Delta variant, my oxygen saturation was hanging around 91 or so. Like I wasn't feeling great. I had a nasty headache. Excuse me, but I was doing well because I had all my little herbs prepared and I was ready for it. Well, I got to some point in my treatment, I got tired of drinking like nasty herb tea and not doing vagus nerve stimulation. So I stopped doing both of those, like in the middle of one day. By the next morning, my oxygen saturation had dropped from 91 to 80. And I thought I was going to have to go to the hospital. It was really, really bad. And I raised two kids for myself. So I had all kind of alarm bells going off in my head. Like, what am I going to do with my kids? And like, here I am. They're going to see me leave the house in an ambulance or in a hearse. I was feeling horrible. So I got my Dolphin Neurostim and set up the vagus nerve stimulation. And over the course of a couple of hours, my oxygen saturation went from 80 back up to about 90. So it was really, really significant in changing my overall oxygen saturation. Elite athletes will use this. So one of the problems you get into with elite athlete groups, especially endurance athletes, is that they have a tendency to overtrain. And if you overtrain for something, you hit a point that your heart rate variability drops and your high frequency vagal tones drops. If those drop too low, you can't really recover from your workouts. So what ends up happening is you have somebody who's training, but they can't get any faster and they can't get any stronger because they can't properly recover. If you do this with vagus nerve stimulation immediately after your workouts, it resets that. Normally, if you do like a super hard workout and put yourself into overtraining syndrome, it's about 3 days of recovery that you need. With this, you can do it. You can do vagus nerve stimulation and go back to working out the next day. We've tracked the numbers on this. It works quite well. Other times you might want to use vagus nerve stimulation. It works great for getting rid of migraine headaches. If you have a migraine headache and you don't want to mess around with finding acupuncture points, if you do basic vagus nerve stimulation like I'm going to show you, the migraine headache will typically dissipate in about 15 minutes or so. It's usually pretty spot on with getting rid of headaches like that. So how do we go about doing vagus nerve stimulation? Well, the first thing you need is a Dolphin Neurostim. And I got a good green light here, so I know this is good. I need a black cable like this, which comes in your kit. It has a male connector on one end, and it has a little cup connector on the other. And if you look, you'll see there is a little shiny plate on that cup connector. So that shiny plate has to touch up near the tip of this unit. So the two pieces of metal have to touch. So you're going to place this on like this. So now I have a cord running off here. And then there is also a white cord that is probably in your bag of electrodes. It looks like this. It'll be like a little, let's see if I've got one of the bundles. It'll come all bundled up kind of like this. And it should have a male end and what looks like a female end. But if you look inside there, you'll see that's actually a male connector as well. This is just shrouded. Some hospitals require us to do that. So that's how we have it set up. You are also going to need some oval electrodes. So there's a card that has some of these little oval electrodes. Obviously, these do fit perfectly on here. We have them specially cut for that. Because of that, these are more expensive. So here's the advice I'm going to give you. This is never going to go on a patient's skin. So if you take an alcohol wipe and clean this surface off really well and get all the skin oil off of it from your thumbs, when you put this on here, it's not going to pick up any of that oil, and you can use this same electrode over. I have some of these that I've used for months and never had a problem with adhesion because I keep this metal plate clean. So always clean this metal plate, and you can use these over and over again. So you're going to stick this on your Dolphin Neurostim. You're going to have your little white cord. It doesn't really matter from a practical perspective which end of this you use. I guess from a hospital perspective, you probably want this end close to the patient and not this end close to the patient. So we're going to stick the male connector into the little white oval electrode. So now I have two wires coming off the Dolphin Neurostim like this. And if I want to make sure I've got a good connection, I can turn the Dolphin Neurostim on. See if I can do all this at one time for you guys. So see how I've got a green light here? Okay, so if I touch these two together, it should complete the circuit and the light should go off. See that? So I've got a nice high pitch and the light goes off. So that's the way you can test it to make sure that your wires are good and that you've got this firmly seated. That's a way to test that. Once you have that in place, you're going to need some rectangular electrodes like this. You have a whole slew of those in your bag. You're going to connect that to the white wire. It's not really the ground, but for right now, we'll just call it the ground wire. So we have something that we can call it. We can get into anode and cathode if you guys want. Let me see if I can untangle this first. Okay. So you want to connect up the other end of the white wire to one of these rectangular electrodes. You will notice that there is a card that comes in your kit, and it has places where you can put these pads. So you can see on the wrist and on the tummy. So the two places we recommend putting this are 4 fingers below the belly button. That makes a lot of sense because you're actually tracking the vagus nerve because it does come down to the stomach. But the other place you can put this electrode is on the wrist. So there are 3 acupuncture points on the wrist known as the golden triangle. They're on the lung, pericardium, and heart meridians. They're really good for calming patients down. Yeah, who is that? Ben, you got it right. So you can take, again, an alcohol wipe and clean your skin really well. If you clean your skin really well, you can use these pads over and over again. Now, you would only use one of these pads on a particular patient, but you could keep this for the next time the patient came in and it would be fine. For yourself, clean your skin really well before you put this on and then stick it on there. So why do we have 2 different locations to put this pad on? Well, everybody's a little bit different in terms of what their vagus nerve needs. I would say the best thing to start with is to stick this 4 fingers below your belly button. Then we have this black cable that doesn't have anything on the end of it yet. So you have a pack of electrodes that come in several varieties of ear clips. And the ear clips look like this. There's a black one. You'll notice that the black one tends to have a metal plate here. These work quite well, but if you have sensitive skin, it does tend to concentrate the electricity a little bit, and people find that sometimes they get like tingling or burning sensation with these. I do recommend any of these that you use, you need to moisten this to spread the electricity out. The next thing on the menu are these little white electrodes that have a fairly flat conductive rubber tip. So this is conductive rubber, has rubber and carbon in it, so it's conductive to electricity, but it's not super conductive. So if you want this to work properly, you need to put either some salt water on there, some electrode gel, sometimes even ultrasound gel works. I typically use this is not something we have on our website, so don't try to buy this from our website because they'll fuss at me. But you can pick this up on Amazon. It's called 1020. It's an EEG paste. You can see it's really sticky or whatever. It takes just a little tiny dab of this stuff, but it does have about the consistency of earwax. So you need to warn your patients ahead of time. That's not earwax in their ear. It's just conductive paste. Okay. And the last on our list of things are these dome electrodes. If you have an older kit, you may not have one of these. So you probably want to order these. So you can see how this rises up above the surface here. Why is that significant? Well, the other place we're going to want to put these ear clips is on the inside of the ear. So there are 3 locations that we give for trying to access the vagus nerve. The easiest would be the earlobe. So any of these works fine on the earlobe. That's not a problem. But the other places, so there was a recent study, it was an MRI study, and they looked for the highest concentration of vagus nerve endings around in the ear. And the 2 most concentrated areas were in the inside of the tragus. So the little flappy thing in your ear here, right here. So this flappy thing, like if you push on it, it closes your ear. Well, on the inside of that is the number 1 most conductive place for the vagus nerve. However, you will notice that any of these electrodes that you use trying to get to the inside of there, they tend to just pull right off pretty easily. So it's not a great location for that. But the second best place is on the upper concha of the ear. So your ear hole is here. If you pull your finger back, you end up in a little hollow right up in here. So this is the upper concha of the ear. So up in here is a really good place to access it. However, if you try to use these flat ear clips, the problem you run into is they don't always connect to the inside because some people have thick ears. But these dome electrodes are specifically made so that you can get back in there and get a good contact on there. So in practice, you would put this on yourself. You connect this to the black wire. You would go to the upper concha of the ear. So I'm going to turn my head and so you guys can watch me do this. This is the tragus right here. If I move up into this area right here, that's the upper concha. So I can stick this right in here, pinch it a little bit, turn my Dolphin Neurostim on, and you can see, let's see here. Oh, that's the problem. You can see that I have a bit, you can hear the device is making a strange sound, but I still have a green light here, which means I really don't have a great connection. So I'm going to get a little bit of conductive paste. I'm going to smear it on this ear clip like this. And you see now the light's off. So you really want to make sure you have a good connection here. So once you have that done, this is where your super secret magic button comes in. So this little black button right here, if you turn that on, it may or may not flash depending. Remember I said there are 2 times you look at the light: when you're trying to determine if the battery is good and when you're finding points. So once you initiate a treatment, don't look at the light because it'll drive you crazy, because sometimes it beeps, and sometimes it blinks, and sometimes it doesn't. So now I'm doing vagus nerve stimulation. So I can sit here, I can wash dishes, I can read a book, I can do whatever. How long do I want to do this? Well, the first time I do this, I want to do a 5-minute treatment. So that's what we do here in the clinic. Most people aren't going to notice a huge difference with 5 minutes, but there are some people out there who have a very sensitive system. You want to establish that before they leave your clinic and not when they get home. So if they have a very sensitive system, after 5 minutes, they will notice that they are markedly more relaxed, and sometimes even a little sleepy. So in that case, you want that person to go very carefully on their increases with vagus nerve stimulation, because it just tends to make them tired if they do too much. I mean, it's a recovery thing, but it can make you pretty sleepy too, and you don't want to do that before you drive. So what do we recommend? 5 minutes of first treatment, and then add 5 minutes a day until you get up to around 20 to 30 minutes, or depending on what your therapist or physician says you need to do. But we generally shoot for that. And you can certainly do more than that, but you need to be careful once you get above 30 minutes that you don't overtreat yourself. You're not going to really hurt yourself, but you can make yourself kind of sluggish and tired, and feel like you don't have a whole lot of energy. So left ear, upper concha of the ear, negative polarity on this device. We're not trying to bring things up. We're just trying to just calm things down. And push the continuous treatment button. Now, once this ends, once the session ends, then it's going to go back to a steady tone like this. And then I can push the button again, and it's going to go quiet, and it'll run for another 11 to 13 minutes until you're done with that section. All right. So why the left ear? The left ear just seems to be more calming than the right ear. If you're going to use the right ear, so I could switch this over to my right ear. If I do this on my right ear, I want to switch the Dolphin Neurostim over to the positive setting. The right ear tends to be more stimulating. When would I use this? I would use the right ear if I were doing vagus nerve stimulation in the morning and trying to get my system up a little bit. If I treated myself and found that I was a little sleepy afterwards, I would do 5 minutes of positive stimulation right ear, and with an electrode on my tummy. Generally, the wrist would be okay, but it's generally better just to go from the right ear to the tummy, just to keep it simple. About 5 minutes of that is what most people need. I have known a few physicians who had their patients go up to 10 minutes or so on the positive setting for specific conditions. So that kind of brings us into what kind of conditions do you want to use vagus nerve stimulation for? Well, one of the things that vagus nerve stimulation does is stops the production of pro-inflammatory cytokines. So if your system is really inflamed with like something like COVID, then it can make a big difference in your recovery. If you have an autoimmune disease of some kind where your system is always inflamed, this is a good thing to use. If you have allergies, this is a good thing to use. If you have irritable bowel syndrome or toxic mold exposure or any of those, vagus nerve stimulation will aid in your recovery. So what you have to think is most of these conditions are conditions of Systemic inflammatory responses. Yes, one person may be more prone to Crohn's disease and somebody else may be more prone to, say, MS or something like that. But in all those situations, the immune system is involved. And if you modulate the immune response, you can modulate how much it affects your patient. So I do have patients who have autoimmune diseases who use these, and they tend to be quite effective in not curing them, but in modulating their response. They tend to have less flare-ups, is what they report back to me. So I find it a useful tool for those kind of people. And if any kind of ongoing sickness, you would want to increase. So how often should you do this? You know, should you do it every day? Should you do it once a week? Well, I'll give you me. I'm 53 years old. I raised 2 children by myself. I just got done doing 10 hours of manual therapy today, and here I am doing an hour and a half tutorial. So I'm going to be pretty tired when I get home. So, you know, I keep up a pretty busy schedule between my kids and work. I travel and I teach and I lecture quite a bit, so I'm going all the time. So how often do I do this? For me, doing this 2 to 3 times a week for about 30 minutes seems to be perfect. Now, if I'm really, really ill, then I will go ahead and do an hour or so of vagus nerve stimulation. When I had COVID, I did hours of vagus nerve stimulation to help myself recover from that. So you can certainly run it for longer if you're in a situation of dire need, but most of the time you don't need quite so much. You need to give your body, you need to kick off the recovery process and then let your body do its thing. You don't want to keep like pushing on things. You got to let your body do what it's supposed to do. So if you are, say, like an elite power lifter and training really hard every day, or an elite endurance athlete or something like that, where you're doing really, really hard workouts each day, then you probably want to do vagus nerve stimulation every day after your workout. If you do that every day after your workout, you will notice that you have much less delayed onset muscle soreness the next day, and you feel much better the next day, and you're generally able to get a lot more out of your workouts. Can you use this on children? Absolutely. I use this on my kids. I have a stepdaughter who's autistic, and when she was much younger, we certainly did this. It is an extremely helpful tool for people who have a lot of anxiety. So a good tool for people with anxiety and depression, and also for people with PTSD. We find that modulating the vagus nerve, they tend to be stuck in the fight or flight response. And modulating the vagus nerve makes a huge difference in how they're able to process through those things. So those are some of the situations for when and where you would use vagus nerve stimulation. Other things about vagus nerve stimulation. In your kit, there is this funky little wire that looks like this. We call it a Y wire or a splitter cable. So you can take your black cable that has the ear clip on it. You can pull that off. You can connect the splitter cable to it like that. Now you can put 2 ear clips on here. So I'm going to get 2 here. I'm going to use a white one so you guys can see it since I'm wearing a dark shirt today. So now I have 2 ear clips coming off of the tip of the Dolphin Neurostim. So now I can put one on either ear. And just for convenience sake, I'm going to stick these on my earlobes. Why would I want to put a clip on either ear? Well, you got a vagus nerve that starts on either side, right? Remember I said the left side tends to bring things down more and the right side tends to bring things up. Well, you can modulate things to some degree with this. So if you're going to do that, you're going to choose the biphasic setting, and you're going to run the electrode to your tummy. That seems to work best. You can play around a bit if you want to with wrist or tummy. Like I said, everybody responds a little differently. That's why we say start slow and work your way up. And you'll kind of find your groove with how it seems to help you out. Other things you guys might want or need to know. Let's see. I have not gone over the wrist extension straps. These don't come in your kit, but you may have ordered them separately unless you took one of our concussion courses. So you have these little things like this. Remember I said earlier, if you're going to do therapy, you need to touch this and touch the skin of wherever you're treating. So if I'm treating, let's say this is my hand and my body is somebody else, I can't just put this down on the skin like this. I have to have skin-to-skin contact because the electrons have to come out of the tip of this, go into my skin, come back up through my finger, and down into this metal. So they've got to complete the circuit, okay? So if I don't have skin-to-skin contact, I'm just doing acupressure. I'm not using microcurrent at all because it doesn't have anywhere to go. So it'll just stop. So it won't actually do what you need it to do. So you have to have skin-to-skin contact. Well, what about like skin to shirt? That's not good enough. If you get somebody who's really modest, they might come in with long sleeves and you're trying to treat points around their face or head. So what you could do is you could take one of these and you could put one of these on your wrist like this. You want to make sure it's nice and snug. You can take the other one and you can put this on your patient. And now you guys are electrically connected. So you still have to touch the metal plate, but you don't have to touch their skin anywhere. Okay. So you can order these from the website. They're probably about 25 bucks. I don't think they're horribly expensive. The other thing that you might want to know about is the extension probe that comes with the Dolphin Neurostim. So you'll notice that it has a little cup on one end that looks familiar because this fits over the end of the Dolphin Neurostim. This extension probe is flexible, so I can bend this into whatever shape I need. So I can tape this to a back scratcher and use it to hit points in my own back. I can use it as a way to get some distance between the device and, say, an autistic kid's ear. If I would doing some ear acupuncture points, it gets the sound away from them. We have seen people use these for intra-oral stuff to treat scars inside the mouth. They make the patients buy these and take them home and clean them. When I was in women's health, we used to use these for episiotomy scars. We would get 2 of them, and the patient had to take them home and clean them and bring them back for us. And we would use these just, on that one single patient. So the patient would order 2 of these. So the patient had to front an extra $50 for these. Anything else in the kit you guys need to know about or that's not in the kit? You can get through the mail. You cannot. We do have large posters like this that are dermatome posters, but you cannot get those unless you come to a workshop because they are terribly expensive to mail and it's a huge waste of cardboard and your money. But you can order these little ones like this. If you are a therapist and doing treatments, you are going to find that this is a very useful tool for treating problems anywhere on the body. But this is a useful tool because you can look and see where somebody's pain is and you can follow it back up to the appropriate nerve root. So let's say somebody had plantar fasciitis. Well, we know that if you do injections down in the heel, those are a very temporary fix. And we know that if you do massage work in the calf, that lasts a lot longer because it loosens all this up because this is what pulls down into here. So all this stuff pulls down into here. So if we work this out manually and stretch this out, have the patient stand on the stairs like this and stretch their calves out, that's a useful thing for plantar fasciitis. But in many cases with plantar fasciitis, something is keeping this tight. And if you look at a dermatome chart, you'll see that the back of the calf is S1 and S2. So if you then go and do treatment over the sacrum with your Dolphin Neurostims over this area right here and connect it up with the back of the calf, then you can get better outcomes with your plantar fasciitis. So that's how you would use the dermatome charts. I think those are, I don't know, $10 or something like that. So that is pretty well all of those things. And I've got you guys, let's see, we need to spend a few minutes talking about questions you guys might have. So let's get into the chat box here and see what we've got. What are the frequencies of the Dolphin Neurostim and what are the different outputs for the negative, positive, and biphasic polarities? Okay, the frequency, so there is a card if you want all the relevant information in the kit. There is a card inside here, which I don't happen to have sitting in front of me. Oh, wait a minute. Yeah, I do. Here we go. This, if you open this up, to page 3. It gives you all the relevant electrical information. It is all right there for you. So that gives you all the outputs and everything. Can you use the Dolphin directly to stimulate acupuncture needles? And if so, can you use the settings? Yes, you can use this to stimulate needles. It works quite well. And I'm going to say this with a grain of salt. Take this with a grain of salt. But with all due respect, if you are using one of those electrical stimulator generators and sticking it on acupuncture needles, that's alternating current. And the reason that that's alternating current is because back in the day when needles weren't so good, if you ran direct current through needles, the problem you ran into is it could polarize the metal and it was more likely to break. These days, those needles tend to be stainless steel wire, so you can tie knots in them and untie them and probably hang, small children with them and all kinds of stuff, and they're just not going to break. So those older generators, which is still what everybody uses, the problem with using alternating current is that when we talked about heart rate variability and high frequency vagal tone, alternating current will tank these. This will lower your cortisol by 50%. If you are using one of those alternating current things on needles, you can actually increase somebody's cortisol. So yes, it pushes energy, but not the best idea. So you can take this and you can do things like, if you want to get tricky, you could do things like take and put an alligator clip on the end of here and just clip it right under the needle, and then you're fine. If that's what you really wanted to do. I wouldn't do it for super long periods of time, but I'm sure that probably 20 minutes or so would be okay. So let's see what else we got. There seems to be a lot of variability in the sound when treating and finding points. What does this relate to? Okay, the higher the pitch, the greater the overall conductivity of the point. So some acupuncture points are actually pretty big. And if you move this around on those acupuncture points, there's going to be one area in there that has the highest level of conductivity. And that's the point you want to pick. So if I had to pick between looking at the light and listening to the sound of this device, the sound always wins because the sound gives you a much more accurate picture of what's going on. Since this is direct current, can you use 2 dolphins to create directional movement along meridians using the first and last points in the chain? Yes, you absolutely can do that. So definite on that. Can you use this for blood electrification protocols via Bob Beck and Jeremy Steiner with the TENS pad over the wrist covering? I have not researched that enough to give you a positive answer on that, so I would need to double check that. I need to look at the protocols first. Will this be effective on scars that are 20 plus years old? Absolutely. I have treated scars. I had a lady one time at a workshop in Santa Fe, New Mexico. She was a physical therapist, and she had been a physical therapist so long that her license number was a double-digit number. So she had been in the business for forever. She was retired. She was bored. She came to one of my workshops. We started talking about scars. She's like, "Oh, I have a scar." So she pulls up her shirt, and right here, there was a hole. It looked like somebody shot her. And when you looked at her back, there was another hole in her back. I said, "Who the hell shot you?" She said, "Oh, nobody shot me. When I was 7, I fell on a garden stake and it went into and through my liver and came out my back." And somehow she lived through this thing. Well, she was in her like 70s or 80s. For the rest of her life, she was all kind of pulled and hunched over for 2 reasons. One, because the scar hurt so bad, she didn't even like fabric touching it. And 2, because it pulled on everything. So one of the students in class, not me, like one of you guys who's never done this before, treated her scar for her. She was sitting up perfectly straight afterwards. So yeah, it works for really, really, really old scars. Do tattoos impact the efficacy of treatment? Tattoos do not affect the efficacy of treatment. Tattoos can count as a scar, though. So that's something to keep in mind. Can you do intra-oral inside, out at the same time, or should it be done inside and then outside? Yes, you can do both at the same time. Let's see what else we have here on the list. If you have knee pain, how many times a day would you do a treatment? Gosh, if it's acute knee pain, you could do 3, 4, or 5 treatments a day. Just depends on what's going on. If you have knee pain like that, I would make sure to treat your back, treat the nerve roots that go. Look at a good dermatome chart. So let's see, your knees are like L3, L4, and L5. So I would make sure to treat the back. And then I would look in the natural health book, and there is a knee protocol. These things are done usually alphabetically. There's a knee protocol right there for you. Got all your points. And I would do those. I wouldn't. Oh, that's another question. People ask me, like, how long, when you put this on an acupuncture point, how long do you hold it? So the general answer is for about 30 beeps. That's not going to be 30 seconds. Now, could you hold it longer than that? Sure, you could hold it for a couple of minutes if you wanted to. But what we find is, generally speaking, 30 to 40 beeps is usually plenty. But you could certainly go longer if you need to. But yeah, when I have had problems, I had some pretty severe neck problems for a while that dealt with some nerve impingements, and I would treat myself 4, 5, 6 times a day just to get some relief until I finally got it worked out. So it's a good tool to use for acute pain as well. Can you treat yourself for scars? You can absolutely treat yourself for scars. It works very well. All right. What other questions might you guys have? Let's see here. I don't see anything else down here. Does anybody have any questions they want to unmute their mic and ask? Everybody's good. Everybody has all the questions answered that they need. Well, while you're thinking about that, there is something I need to talk to you guys about. And tomorrow you're going to get an email from us. And that email is going to serve 2 purposes. One, it's going to give you a link so you can come back and watch this over again. You can watch this as many times as you want to. So you can go back and review things. I move pretty fast through these. I talk pretty fast, and there was a vacuum cleaner in the background for at least part of this. So you can go back and review this tomorrow or at any point you want. There is also an invitation to join our Facebook forum. I do recommend that you do that. It's a place where therapists and patients and everybody who owns these devices can get together and talk about, you can find someone to treat you. You can find someone to practice with. You can find people who are treating conditions that you've never thought about treating before. Like, how do they do that? And those of us who teach this stuff tend to get on that Facebook page and answer questions for you guys. I'm not on there probably as much as I should be, but I do try and get on there and answer questions for you guys. So you can certainly do it that way. And if you want to, you can sign up for this again. Like, it's free if you have the equipment. So I might be wearing not a blue shirt. Maybe I'll be wearing a red shirt next time. And maybe I'll talk about how to treat acupuncture points on horses or something like that. It's going to be the same basic talk, but I may change things up a little bit. Let's see, what other questions do we have here? Do you have a specific class for scar work? Yes, we do. So this is a tutorial. This is short and sweet. We have full weekend workshops that are in person. Those are some of my favorite things to teach. I love teaching introductory courses and scar courses and concussion courses. We have a lot of different courses that we teach. They are all typically on a Saturday and Sunday. They're usually good for like 16 contact hours. There are some online courses that we have as well. Some of them are live and some of them are pre-recorded. So depending on what your needs are, they're available that way. So you can digest them in smaller segments if that's what you want. But we definitely do have courses that you can take. And they're a lot of fun because it's a lot of therapists coming together in one place. We do limit class sizes to about 20 people or so, depending on the size of the place, sometimes 25. And the topics vary. So I do a really cool introductory course. We do SCAR, like an advanced SCAR course. We do a concussion brain injury course. And I'll even be up in I'm doing a private course for Shepherd Center up in Atlanta in a few weeks here, and that's going to cover a lot of neuro and brain stuff. So we have a lot of different things that we cover in courses. So if you get a chance, look on our website. It should tell you at least when some of those courses are coming up. Have you used vagus nerve treatment for AFib? So I haven't specifically tried to treat AFib with it. I can tell you that it theoretically should help modulate it to some degree. But it's not something I've studied extensively. I will refer you to an acupuncture point on the pinky finger called Heart 9. It's on the inside right here at the corner of the nail. It's H9. It falls in the category of Jing Well points. It's an emergency acupuncture point. It's used for heart attacks, strokes, and even works well for migraine headaches. But that one may affect AFib to some degree. When is the biphasic mode most often used? Biphasic is mostly used when you're doing scars. It's going to be one of the two chosen things on there. Occasionally, when you get done with a treatment, so let's say you've done all the acupuncture points, and there's still like one little spot where it's tender, I'll take this and put this on the biphasic channel, and then just go directly to that area and find some place that's conductive and treat it. So you can use it. You can use it like as a point and treat kind of device. That's fairly basic, but it does alleviate pain to some degree. I'm in Florida. Any here? Oh my goodness, yes, tons in. Let's see, whose is that? It's Chrissy. Yeah, there are tons in Florida. Yeah, we do DeLand and Orlando, and we try to get into South Florida some, Vero Beach. So we're definitely down there. Will this help all body neuropathy? And if so, what would be the general treatment? Well, it depends what the neuropathy is from. Is it from Agent Orange or is it diabetic neuropathy? All those are going to be a little bit different. I know one guy that I've met who goes to see a friend of mine who does this, and he has Agent Orange neuropathy. And the strange thing is he walks literally. He came to one of my workshops in Atlanta. He hobbled in with a couple of canes, and we treated the scars on his body. And he walked out with his canes like over his shoulders, and he gets that done about once a month. You can do any other acupuncture points you want on that guy, and it doesn't help his neuropathy. If you treat his scars for whatever reason, he regulates everything, and he's good. But with somebody who's got like diabetic neuropathy, there's a program in the practice where I work now that focuses on diabetic neuropathy. You do need to pay very close attention to the supplements you're taking and to dietary stuff. Like all the sugar's got to go, all the processed wheat's got to go. Like those are really important. Anything that's inflammatory's got to go. Are there any classes? Our classes? No. Well, yes, there are classes in Ontario, specifically in Toronto, because that's where the headquarters are. So you can certainly take workshops there. We have had some units go to Nova Scotia. We have not taught any workshops there. However, if you're in Nova Scotia and you would like a workshop, if you can get together, say like 12 people or so, we can probably do it. If you can find me a location and find me some people who want to take the workshop, we will come out and do it. That is not a problem at all. Let's see. So for the neuropathy all body, you're going to do a lot of vagus nerve stimulation. You're going to do a lot of spine points. You're going to do a lot of parasympathetic calming points. Those are a good place to start. I saw a video on the website for treating Parkinson's disease. I have a client in Denmark with Parkinson's. Can a person treat themselves or would they need to? Actually, that video that you saw, the Parkinson's disease patient, like that was all vagus nerve stimulation. That's somebody who got one of these devices and started doing vagus nerve stimulation and has done quite well. And when I worked in a neurology clinic, I have treated quite a few Parkinson's cases, and we get we don't cure Parkinson's disease, but we do a really nice job of getting rid of a whole lot of the symptoms of it. I even used to treat one of Michael J. Fox's friends, a guy who had a deep brain stimulator for Parkinson's. And he still had tons of symptoms, and I could treat him. We could knock things way, way back. And so that was pretty advanced Parkinson's. Is this good to treat arthritis? Absolutely. I'm a manual therapist. I've been doing manual therapy for 30 years. So you can bet I've got some arthritis in my fingers and joints and stuff like that. So you can treat directly over the joints. It works well for that. If you have systemic arthritis, like if you have arthritis in all your fingers and everything, chances are you're systemically inflamed and you want to use vagus nerve stimulation and treat over the areas where you have problems, because you have certainly more going on than just arthritis. If it's affecting your joints, it's affecting your organs and everything else. Okay, guys, we are at 9:05, and I still have to go home and put my children to bed. So I'm up at the office right now. So I'm going to wish you guys a happy evening. And if you have more questions, get on our Facebook forum and ask your questions there. Let's see. We got one more kind of thing here. So you guys have a lovely evening, and thank you for coming out tonight, and come back and see us again. So catch you later. Bye-bye.